Hello guys, this is anatomy question paper of second terminal exam for MBBS 2022 batch at Naraina Medical College, Panki, Kanpur. This exam was conducted on 12th of June 2023 and this was anatomy paper 1 part 1 which I have already solved and uploaded it. You can watch it from the link provided. Now this is anatomy paper 1 part 2 of the same exam. Here also the marks distribution was same. There was one long question of 10 marks. Then there were 4 short answer questions which were of 5 marks each. So 20 marks for this. And then 5 ultra short questions of 2 marks each. That makes 10 marks. And lastly there were 10 MCQs of 10 marks. So that makes 50 marks question paper. Now let's begin with this. Question number 1. One student is climbing the stairs at a fast pace as he is late for his examination and the lift got out of order. His heart is beating fast against his chest wall. He has dryness of mouth and sweating of the palm. What is the reason for rapid heartbeat? That's tachycardia. And the next question is, what is the effect of sympathetic system on the skin? Right? So you have to understand the question, what actually it means. There's a single word that comes out from the question, and that is anxiety. Read it once again. One student is climbing the stairs at a fast pace as he is late for his examination. So means he has anxiety to reach the examination on time, and that's why he is running fast. He's climbing fast. And doing so, of course, his motor activity is exaggerated, more of contraction of skeletal muscles, more of requirement of oxygen, and all the consequences thereby arising from the state of anxiety. So answering to the first part, that what is the reason for rapid heartbeat, that's tachycardia. Now think that one student is climbing the stairs at a fast pace. Now why is he in a fast pace? He could have climbed up the stairs in a relaxed mode also. It shows that he is in a state of anxiety, right? As he might be late for his exam. So this entire case scenario is based on the manifestations of anxiety. Now this anxiety is a cortical problem which is assessed by the cerebral cortex. In case of any mood disorders like anxiety, happiness, depression, phobias, pleasure, or any impulsive behavior, any emotional state of mind, all these conditions are assessed by the brain cortex. And accordingly, the brain sends impulses to bring a state of sympathetic hyperactivity. Now, how does a brain reacts to maintain this body in such an emergency condition like an anxiety? It sends impulses to the posterior hypothalamus and the paraventricular nucleus, which is the chief autonomic center of the brain or the CNS. Now from there, the posterior hypothalamus, the impulses are sent down to the dorsal longitudinal fasciculus to the brainstem. From there, these impulses travel down to the lateral horn of the spinal gray matter of the segments T1 to L2. Remember, that's a sympathetic outflow from the spinal cord. From there, the efferent preganglionic neurons emerge out and relay in the sympathetic ganglia. And from there, the postganglionic sympathetic fibers reach down to participate in the sympathetic autonomic nerve plexuses, like the superficial and deep cardiac plexus. And that you know how the superficial and deep cardiac plexuses are formed. There are superior, middle, and inferior sympathetic cardiac nerves arising from the sympathetic chain in the cervical region. So from both these sides, these nerves reach down to participate in the deep cardiac plexus. And deep cardiac plexus, you know, is located over to the carina. That's the bifurcation of the trachea at the level of T4, T5 transverse section. Except the left-sided superior cardiac cervical sympathetic branch from the sympathetic chain, which reaches down to participate in the superficial cardiac plexus. And the superficial cardiac plexus, you know, is lying there below to the arch of aorta over to the left pulmonary artery. In between the left pulmonary artery and the arch of aorta, there is this superficial cardiac plexus. This is also somewhere at the level of the lower border of T4 vertebra. And from these plexuses, these postganglionic sympathetic nerve fibers, they run along the coronary vessels, mainly the coronary arteries, to reach there into the myocardium to stimulate the contraction of the cardiac muscles. Now, there is another mode of action of brain to bring about this state of sympathetic hyperactivity, and that is neuroendocrine pathway. Why the splanchnic nerves, the greater and lesser splanchnic nerves, reaching down to the celiac plexus, and from the celiac plexus, these preganglionic, remember they're the preganglionic sympathetic fibers, which reach down to innervate the adrenal medulla. So these are the preganglionic myelinated nerve fibers from the segment mainly T10 to L1. Because these are preganglionic myelinated fibers. So remember, now they're going to synapse or they're going to stimulate the postganglionic sympathetic fibers. And in the adrenal medulla, there are chromaffin cells. These chromaffin cells are actually considered as the postganglionic sympathetic neurons. And that's why they're also called sympathogonia. So at this side in the suprarenal medulla, now this electric impulses brought about by the preganglionic neurons will convert into a chemical stimulus. And these chromaffin cells will liberate the epinephrine or adrenaline, norepinephrine or noradrenaline. These are the neurotransmitters which are liberated by the suprarenal medulla into the venous circulation through the suprarenal vein. And on the right side, this right suprarenal vein drains into the IVC directly, but on the left side, the left suprarenal vein drains into the left renal vein, and then via the left renal vein, it is drained into the inferior vena cava. And that's how this neurotransmitters, the adrenaline, noradrenaline, they reach to the right atrium to stimulate the SA node. And with the stimulation of SA node, there is a rapid impulse conduction, and that brings about tachycardia. This provides excess cardiac output to meet the increasing oxygen demand of the rapidly contracting skeletal muscles as the student is climbing up the stairs at a fast pace. So that's how you can explain this answer to question number 1A. Next, 1B, what is the effect of sympathetic system on the skin? In the question already they have mentioned that they have dryness of mouth and sweating of the palms. So remember, the effect of sympathetic system on the skin is mainly categorized into three headings. One is pseudomotor, which means excessive sweat secretion from the palm and soles, from the thick skin. Then you have vasomotor. Vasomotor is actually vasoconstriction of the peripheral vessels supplying the skin. And pilomotor. The pilomotor is contraction of the muscle erector pili, which causes the erection of the hairs, and that's called goose bumps or goose flesh formation. So that's how you can explain the answers to this type of question. Now moving to question number 2, write short note on nerve supply of intrinsic muscles of palm. It's a very important question. I have made a video on this and uploaded the link. You can watch the video from that link. Next is bronchopulmonary segments of the lungs. Super important question. Remember, you should know this question before going for your exams, and you can read it and learn it from the book. Thoraco-abdominal diaphragm, super important. Make sure you also include the clinical anatomy regarding this, the hernias through the major openings, congenital and acquired, all type of hernias have to be mentioned, and its role in respiration also has to be mentioned. The development may not be included if it's not asked. The next is 2D, medial plantar nerve. This also is important. Remember, in the soul, it innervates 4 muscles: abductor hallucis brevis, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical. Apart from its motor innervation, it also innervates the major portion of the skin of the soul, the medial two-thirds of the sole except the heel and including the skin of the medial 3.5 digits, including their nail beds on the dorsal side. And don't forget to mention about the Morton's neuroma. Question number 3. Write short notes on medial longitudinal arch of foot. It is important, you should know it. Anterior cruciate ligament of knee joint. It is important, you should know it. Remember to mention about the anterior draw test and why is it more prone for injury comparing the PCL. Remember, it's this ligament which prevents the hyperextension at the knee, and it is thinner and shorter and it winds laterally in the knee joint, because more oftenly we are using forceful extension at the knee and forceful flexion is less often required in a regular life. Question number 3C. Normal constrictions in esophagus. So remember that esophagus normally has 4 sites of constrictions. The first one is at the pharyngoesophageal junction. You know that 6 inches from the incisor teeth. That lies at the level of C5, C6. And then it's due to arch of aorta, which is around 9 inches from the incisors. And that lies at the level of T4, T5. And then the third constriction lies at the level of left main principal bronchus, which is around 11 centimeters from the incisors. And in the end, when it pierces the diaphragm, right, to reach into the stomach, that's around 15 inches from the incisors, and that lies at the level of T10, T11 junction. Trendelenburg test for abductor mechanism of hip joint, super important question. I have made a video on this. I have uploaded the link. You can watch it from there. Then structures derived from the first pharyngeal arch, important question from the general embryology section. All the skeletal, muscular derivatives as well as the blood supply, nerve supply you have to mention in this. Then question number 4, multiple choice questions. Umbilical arteries after birth occlude to form medial umbilical ligament, median umbilical ligament, lateral umbilical folds, ligamentum teres hepatis. So remember that umbilical arteries after birth occlude to form medial umbilical ligament is the answer here. Median is due to obliteration of urachus, and lateral umbilical folds is due to the peritoneum covering the inferior epigastric arteries or the inferior epigastric vessels. Ligamentum teres hepatis. Now this is due to obliteration of umbilical vein, and it's the left umbilical vein which persists till birth. The right umbilical vein perishes early during embryogenesis, around the 4th week of intrauterine life. Question number 2. Nerve supply of the short head of biceps femoris is tibial part of sciatic nerve, tibial nerve, common peroneal part of sciatic nerve, common peroneal nerve. Remember that the short head of biceps femoris is the only muscle that takes origin from the linea aspera, that is on the posterior surface of the shaft of femur. And because it's in the thigh and the nerve is sciatic nerve which is running in the back of thigh. So the answer here is common peroneal part of the sciatic nerve. The rest, all of the true hamstrings, they are all innervated by the tibial part of the sciatic nerve. Question number 3. Transitional epithelium is present in all except urinary bladder. Of course, it's present. Ureter, of course, it's there. Prostatic urethra also has this transitional epithelium. Penile urethra, remember, penile urethra has the pseudo-stratified ciliated columnar epithelium, which is continuing right from the epididymis, vas deferens, seminal vesicles, ejaculatory ducts, then membranous part of urethra and the penile urethra. The entire ejaculatory pathway is lined by pseudo-stratified ciliated columnar epithelium. So penile urethra is not having this transitional epithelium. So the answer here will be D, penile urethra. Question number 4. Internal thoracic vein drains into subclavian vein, brachiocephalic vein, internal jugular vein, external jugular vein. So remember, these internal thoracic veins are actually the vena comitatus accompanying the internal thoracic artery right from the foramen of Morgagni, that's a Lary's space a minor opening in the abdominal diaphragm adjacent to the xiphoid process at the level of the seventh costal cartilage. From there, these two veins enter into the thorax on the two sides of the internal thoracic artery. So these two vena comitatis, they join at the level of the third rib generally, or the third costal cartilage, and then they form the internal thoracic vein. So it is a short vein, and both of them ascend up to reach into the superior mediastinum, where they drain into the respective brachiocephalic veins of the two sides. So the answer here is brachiocephalic vein. Question number 5. Infrapatellar nerve is a branch of saphenous nerve, anterior division of obturator nerve, lateral cutaneous nerve of the calf, intermediate cutaneous nerve of thigh. Answer is saphenous nerve. Remember that saphenous nerve is a branch from the posterior division of the femoral nerve. It is a deep nerve until it's in the thigh. When it reaches to perforate the deep fascia at the level of the transverse crease of the knee joint on the medial side, and then it becomes cutaneous to travel down on the anteromedial surface of the tibia anterior to the medial malleolus, reaching down to supply the skin on the upper medial side of the medial border of the foot up till the ball of the greater toe, right? But in its course, as soon as it emerges into the subcutaneous tissues, it soon gives its recurrent branch which ascends up to supply the skin overlying the ligamentum patelli, and that branch is called infrapatellar nerve, which is a branch from saphenous nerve. Question number 6. Which of the following muscles is not attached to the proximal phalanx of the thumb? Options are flexor pollicis brevis, abductor pollicis brevis, opponens pollicis, adductor pollicis. So all these muscles, you can see there, all muscles can be categorized into a single heading, and that is the muscles of thenar group. So remember, all these muscles, they act on the proximal phalanx of the thumb, except opponens pollicis. Remember that opponens pollicis inserts onto the lateral aspect of the shaft of first metacarpal, causing to twist it medially, right? That's the action of opponens pollicis. Question number 7. Biceps brachii muscle is attached to all the bones except scapula, humerus, radius, ulna. So remember that biceps brachii arises by its two heads. The long head arises from the supraglenoid tubercle of the scapula, and the short head takes origin from the posterior-inferior surface of the tip of the coracoid process of the scapula, right? So origin is from scapula. Then its tendon gets inserted onto the posterior aspect of the radial tuberosity on the radius. And remember, there is a flattened aponeurotic expansion from the tendon of biceps brachii, which also forms the roof of the cubital fossa and gets inserted onto the posterior border of the ulna. So answer here is humerus. So remember that biceps brachii muscle bypasses humerus. From scapula, it reaches to the bones of the forearm, thereby acting on the two joints in its way. It acts both on the shoulder joint as well as on the elbow joint because of the same reason. Question number 8. Bronchopulmonary segments are well-defined sectors of the lungs, each one of which is aerated by a separate secondary bronchus, tertiary bronchus, terminal bronchus, respiratory bronchiole. So remember, it comes into the definition of bronchopulmonary segments that each of these sectors are well-defined pyramidal segments with their apices towards the hilum of the lungs, and each of these segments, they have their own bronchus, their own pulmonary arteries, bronchial arteries, and they are all aerated by the tertiary bronchus, also called the segmental bronchus, while these pulmonary veins are intersegmental. Question number 9. Which statement is wrong regarding movements of the rib cage during deep and forced inspiration? The options are: first rib is elevated. Remember that they're asking is the wrong statement. So the first rib is elevated. The concavity of the thoracic spine is increased by the erector spinae. The scapulae are elevated and fixed. Alignesi open up the external nares. So remember that the first rib, of course, is elevated because of this role of sternocleidomastoid, scalenus anterior. These muscles act upon during forceful inhalation to elevate the first rib. The scapulae are elevated and fixed. That's a role of trapezius as well as levator scapulae. They also act as an extrinsic muscles to help elevate the scapulae and fix it to provide action of pectoralis minor. In other sense, if scapulae are fixed, then pectoralis minor will act on the ribs to elevate them. So fixing the scapulae is also a role in deep inhalation. So this also is the correct statement. Then alignesi open up the external nares is also correct because you need to dilate the nares to take in more of air. Now talking about the B choice, you must have guessed, that's why I skipped it. The concavity of the thoracic spine is increased during erector spinae. So remember, as the name suggests, erector spinae is to erect the spine, right? So it acts on these vertebrae, the entire spine posteriorly, especially when talking about the dorsal spine. So it actually is acting upon from behind the thoracic spine so as to cause erection in the thoracic spine, and that way it causes actually to decrease the concavity of the thoracic spine. So the answer here is B, which is a wrong statement during deep and forced inspiration. Lastly, the last question, the last MCQ, the question number 10, the line of gravity passes through cervical and lumbar vertebrae, anterior to the hip joint and in front of the knee and ankle joint, cervical and sacral vertebrae behind the hip joint and in front of the knee and ankle joint, cervical and lumbar vertebrae behind the hip joint and in front of the knee and ankle joint, cervical and sacral vertebrae behind the hip joint and knee joint and anterior to the ankle joint. There is a video on this, the line of gravity, the center of gravity. I have very well explained about all these little facts in that video. I have attached the link to this video. You can watch it and understand the entire concept from that video. Right now, just remember that this line of gravity will pass through the cervical and lumbar vertebrae because these are the two segments of the spine which have an anterior convexity, and that's why these two are called the secondary curvatures of the spine. And remember, that's why it will pass behind the hip joint, but it will pass in front of the knee and ankle joint. So answer here is C. And it is done.